If you have Crohn's disease, then you'll know all about living with this painful inflammatory disease of the intestines. But does Crohn's disease mean that it will be harder for you to fall pregnant? Well, in today's video, I'm going to talk about what Crohn's disease is and let you know the answer. Stay tuned to find out. If you've only recently been diagnosed with Crohn's disease, you might still be trying to get your head around what it is. So let me give you a quick summary. Crohn's disease is an inflammatory disease that can occur right along the length of the digestive tract. Now, unfortunately, symptoms are unpleasant and include intestinal ulcers, abdominal discomfort, pain, reduced appetite, and sometimes weight loss. Now, it can also impact your body's ability to absorb some nutrients. Crohn's disease and another similar condition called ulcerative colitis belong to a group of diseases known as inflammatory bowel disease. So, if you have Crohn's disease or are being investigated by your doctor for it, could it affect your fertility? Well, I'll start with the good news first and say that your chances of falling pregnant are very similar to women who don't have it if your Crohn's disease is well treated and in remission. But there can be a few additional challenges. Firstly, if you're in the midst of an acute flare-up episode of Crohn's, you might have more trouble conceiving during that period of time. Also, if you've had abdominal or pelvic surgery, like a partial or total gastrectomy, then this can affect fertility rates, most likely due to internal scarring around the fallopian tubes. Now, there are also instances where the medications used to treat Crohn's disease can cause a temporary, but usually reversible reduction in fertility too. Now, secondly, if you've experienced a significant loss of body weight or have developed nutritional deficiencies as a result of your Crohn's, these can also impact your ability to conceive. But don't worry, as these are treatable with the right care. So we'll discuss these in just a minute. I should also state that there is an increased risk of pregnancy complications like miscarriage and preterm delivery if your Crohn's disease flares up during pregnancy. So just make sure that you work really closely with your treating doctor during pregnancy. Also, corticosteroid medications have been associated with an increased risk of gestational diabetes. So if you're taking them, you'll need to be extra vigilant. I'd highly recommend that you check out my videos on gestational diabetes so that you know exactly what to do to avoid this. Now, taking all this together, basically what it means is that the best time to get pregnant is when your Crohn's is in remission. Now, while you might not be able to control when a flare-up is going to happen during your pregnancy, it makes sense to go into pregnancy in as stable a state as possible. And that's because a flare-up at the time you conceive means that there's a good chance it's actually going to remain active throughout your pregnancy. One bit of good news for women with Crohn's disease who are planning to conceive is that pregnancy is actually beneficial. That's right. Studies show that women who have had children actually have lower rates of needing surgical intervention for their Crohn's later in life. They also have fewer relapses. Good news, hey? So, seems like lots of babies is the answer. Now, as I said earlier, if you have Crohn's, you're at high risk for nutritional deficiencies. So it's important to check your nutritional status before trying to conceive. The inflammation that occurs along the length of your digestive tract can affect absorption of certain nutrients. During a flare-up, symptoms like diarrhea and vomiting can also cause you to lose fluids, nutrients and weight. And you might eat less because of nausea or cramps and the changes in how your food tastes. So there's a few key nutrients that I'd really like you to focus on before trying to conceive. Number one is folic acid. Corticosteroid medications used to control a Crohn's flare-up have been associated with a small but increased risk of your baby being born with a cleft palate. And while your Crohn's is active, you might not absorb very much. So if you have Crohn's, it's usually recommended that you take extra high doses of folic acid supplements before conceiving and during your first trimester of pregnancy. Secondly, low levels of iron and vitamin B12 in Crohn's disease are a major cause of anemia, and this can be particularly problematic during pregnancy. Iron supplements can actually aggravate your Crohn's, so I'd recommend trying to get your iron from food, or if you need to, getting intravenous iron. Now thirdly, vitamin D deficiency is also really common with Crohn's, and some studies suggest that low vitamin D levels can also be associated with infertility, so it's worth getting that checked out too. Some other micronutrients such as selenium, magnesium and zinc may also be low, so before trying to become pregnant, it's certainly worthwhile getting your doctor to do blood tests just to check that you're in really good health. Now, it may also be helpful to note that preliminary studies on turmeric, prebiotics and probiotics suggest that these compounds can also be helpful in reducing flare-ups. So it can be a really good idea to think about taking these as you get into pregnancy as well. Now, if you're not in the best of health nutritionally and are suffering any symptoms related to anemia or weight loss, it can be even more important to pay attention to your diet at this time. This is where getting the expert advice of a dietitian will definitely help, so make sure you do that. Now, I'm sure that you've got loads of questions, so feel free to comment in the chat box below or to make an appointment to see a dietitian for more information. All right, so let's summarize. So, women with Crohn's disease are just as likely to fall pregnant as women who do not have Crohn's, but if you are experiencing flare-up, then it's best to consider delaying your pregnancy for a short time until it's under control. Secondly, make sure that you check for key nutrients like vitamin D, folate, iron and B12. Thirdly, ensure that you're taking extra folate before conceiving and during your first trimester. And then finally, if you are struggling to conceive, make sure that you make an appointment with a dietitian. Now, I'd also recommend that you download my free fertility meal plan to help you to prepare your diet for conceiving. You can download it from www.melaniemcgrice.com/fertility. If you haven't done so yet, make sure to subscribe, and I look forward to catching up with you next week on Nourish. Have lower rates of certain blah 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 blah. May as well get my things in here. All right, let's keep cracking. All right, number one is folic acid. Corticosteroid I can never say that.